Well, indeed, I think it's well known that we have got the biggest epidemic in the whole world with about 7 million people infected, and we have to put as many as possible on ARVs in order to get them virally suppressed so that the virus is no longer transmitted. So for that reason, we are running the biggest antiretroviral program on earth. And so we had to do everything in our power to make sure that the medicines are affordable. We started in 2010, massively reduced the price of ARVs by 56%. Then we went over to 2012 when we introduced the FDC, the fixed dose combination. At that time, it was costing 314 Rand per person per month. After the fixed dose combination, it cost 89 Rand per person per month. We are now on the verge, starting from July this year, to introduce a new fixed dose combination with dolutegravir, and it's going to go down to 75 Rand per person. Oh, yes, it has markedly done so by increasing the pool of drugs that are available, so that introducing accessibility, but also competition, because as you know, competition will knock the prices down. So they've helped us introduce new drugs into the market, and we believe, for instance, without the medicine patent pool, we would not have been able to introduce some of the changes that we've done, like this dolutegravir I've just mentioned. The medicine patent pool did a very good thing by negotiating with originator companies to issue licenses for those who will produce medicine at an affordable price and make them available to the population, and that's exactly what has happened. Oh, the challenges is that the program is huge, but the biggest challenge, maybe the program is huge, and sometimes pharmaceutical companies cannot cope with the supply. You know, the demand is too high and the supply sometimes becomes wanting. But the biggest problem we are faced with is loss to follow up, because we have realized that we are putting 600,000 people per annum on ARVs, and after 6 months, 20% of them get lost to treatment, which is quite problematic. But we have started a new program to deal with that. In February only, we were able to trace 29,000 of those who were lost to treatment, and we are going on doing that. But that's really the biggest challenge, the big challenge we are having. The second challenge is that if you look at the South African program on ARVs, in 2004, we had 400,000 people on ARVs. Today we have got 4.5 million. It means it grew more than tenfold within this short period of time. And the health workforce, the health facilities could not have increased at that level. So the result is long waiting times. That means you have got more and more people looking for healthcare, and it causes long waiting times, irritating people. It also contributes to drop out of treatment, where people get discouraged for going to wait for a long time. And you add to that the explosion of non-communicable disease, which I believe you are aware of, diabetes, high blood pressure, cancer, which we share with most of the world. So the overall result is that we are overcrowded in our hospital. The demand is very high, and that can be very tricky. Young women between the ages of 15 and 24 have found to be particularly vulnerable. While new infections are going down in other age groups, they are unfortunately going up in this age group. And this is the age group of people who are about to be adults, who are going to be very sexually active, who have already started actually to be sexually active, and it's worrying us. That's why in South Africa we have established a special program called She Conquers, which specifically caters for this age group, young women between the ages of 15 and 24 years. It's quite surprising. These are some of the challenges that we are faced with globally. Quite surprising that technology is so advanced, but up to this era, we still have a situation where we struggle with pediatric formulations because attention was never paid to them. A situation where you still have to break a tablet into pieces in order to cater for a 3-month-old baby. will be very happy if the medicine patent pool can trail some of their guns in that direction of pediatric formulations for both HIV/AIDS and TB. Absolutely, absolutely. To start with, cancer drugs are devilishly expensive. And I've just told you there's an explosion of cancer. In fact, I was saying I suspect it's going to be our new HIV, sort of in terms of scale and demand. And lots of social movements are going to be formed. They are already starting to march because they can't afford the prices. So if the MPP, the medicine patent pool, move into that area, that will be greatly, greatly helpful. But in areas like TB, we still have drugs like betaguline, which have proven to be extremely effective in the treatment of drug-resistant TB, the betaguline and the laminate. If medicine patent pool can move in that direction, that will be very helpful. But you also have expensive diabetic medication. Diabetes is also on the increase. So those are the areas: TB medication, cancer medication, and diabetes medication, and other areas. But these three, if you were to move in that, it will bring a huge change and a huge relief.